The next case is a 67-year-old male who presents to review his biopsy results. He has a 15-pack-year history of cigarette smoking. The biopsy confirms a diagnosis of nicotinic stomatitis. Clinical examination reveals erythematous and leukoplakic lesions on the hard palate that cannot be scraped away. Now the question is, which best describes the pathophysiology of the diagnosis? Is it acute, granulomatous, infectious, or reactive? So let's find out. Now this case is of nicotinic stomatitis, as was shown by the biopsy result. Now the first option is acute. So is it acute? Let's find out. Now in the clinical presentation, you can see that it happens on the hard palate as a result of prolonged exposure to heat. So it is because of prolonged exposure to heat. So it cannot be acute. It is a chronic case. So this is not the right answer. The second point is that it is gray or white papules with red dots in the center. You can see we have white gray papules with red dots in the center. Now coming to the second option, is it a granuloma? So granuloma is a structured collection of immune cells, you can see here, including macrophages that surrounds a foreign substance or infectious agent. Such a process is not observed in nicotinic stomatitis, so this is also not the right answer. Then we have infectious. Now nicotinic stomatitis arises from exposure to hot smoke, okay, from the cigarette rather than an infectious agent. So infectious is also not the right answer. Finally, coming to the reactive, which is the right answer. So nicotinic stomatitis is a reactive lesion because it happens as a response to prolonged exposure to heat. It is a reactive process that happens because of prolonged exposure to heat. So D is the right answer. See you in the next one.